So students, now I want to discuss the preparation strategy in detail and separately for the students who are targeting NEET PG 25, and then I'll discuss about the students who are targeting INI 24. And for that, I would request Gobind sir to join me and give us important inputs. Gobind sir, please.
Hi Dr. Praveen. Thank you very much for having me.
Gobind sir, we will start with the NEET PG 25 strategy. So students, the NEET PG 24 exam gave us some shockers. There were certain new things and certain things remained the same. But definitely we want to take into account whatever new things are happening in the exams. So these are some of the things that are extremely important if you are targeting a good rank. Gobind sir, I have enumerated these things here. The first one I think is the foremost thing, conceptual and clinical learning. How important is it, sir?
So the conceptual learning has been important since the beginning. So any exam, maybe NEET exam, maybe even UG exams, without concept you cannot move forward. So I have been teaching the PG entrance students since 20 years now, and the concepts were important at that time also and now also. But at present, the concepts have become even more important. So if you see the recent exam of NEET 2024 and even for the FMG exam recent, so the questions are more clinically oriented and more conceptual. So previously you could have answered many questions just by the factual knowledge. Just by rectifying you can answer many questions, but now the number of those questions have reduced quite.
Right, sir.
And second thing, the concepts are also being asked in a little more detail.
Right, sir.
Yeah. Now another important thing about the conceptual learning is it becomes easier to remember facts if you have good concepts. Just like if I say you that you need to remember so many numbers,
Right, sir.
it will be difficult.
Right.
But if there is a story with every number, then it is easier to remember that. So the same thing happens with concepts.
So a very important thing sir is saying that concepts are important not only in themselves, but they improve the retention of facts as well. And this is so true. This is so true. Concepts are important, students, but at the same time, we have to have a source which is concise, which you can revise in the last days, and which is manageable. So we are talking about both the things. We have to have good concepts, but that does not mean that the concise material loses its importance. It is equally important. Gobind sir, this is something that you always teach the students, that ensure that your preparation has a structure and get disciplined. So what exactly is our advice to the students?
So basically what I am seeing is since many years, most of the students, what they are facing the problem is they start the study. Almost everyone want to crack the exam. So they start the study with enthusiasm. They will study for 10 days, 15 days, 20 days, and then they feel burnt out. And many times they stop in between. So they can stop study for 15, 20 days, maybe 12 hours a day. And then suddenly for next 10 days, 15 days, they do not study. Okay. So here comes the role of discipline. So you should study daily, may not be 12 hours. If you are studying for 8 hours, 9 hours, it's okay, but it has to be consistent. So discipline is very important. And second very important thing is structure. So that is where most of the students are lacking. So like I see many students, brilliant students, they start studying one subject, they start studying, and during study they think that this is also important, this is also important. They keep on studying, then do not realize that instead of 1 week, they have given 1 month. And they do that for 2 or 3 subjects, and then suddenly the time is over. So rest of these 8, 9 subjects are left. So that causes a big problem. So what is important is you need to study every subject, but you need to allot a particular time to every subject depending upon their importance. So you need to cover all the important things in that stipulated time. So that is what is meant for with this structure.
And Gobind sir often says that we should also know when to stop. So you start studying pharmacology, it's not that you can continue studying pharmacology for 15 days. After 4th day, you have to tell yourself that okay, the time is getting over, I have to stop, I have to move on to the next subject. MCQ practice has always been important, will always remain important. Entrance examination is not only about content, it's also about the art of solving MCQs. Even if you do not have complete information, you can solve many MCQs. Learning that art is quintessential when you are preparing for an entrance examination. PYQs, PYTs, Gobind sir, again there was a lot of chatter about the importance of PYQs, PYTs. Now we have the results. Now we have taken like 30 interviews of the toppers and mid-rankers. what is our advice as far as the PYQs and PYTs are involved?
So since the beginning, so PYQs and PYTs will remain important. They were important 20 years earlier, they are important today, and they will remain important even for 20 years later. So there are two important things. Number one, PYQs, PYTs, minimum 50% even in the toughest of the exams, topics will be almost same.
Right.
50% I am saying is the minimum.
Right.
So most of the exam, they are 70 to 80% of the PYTs in particular. And the second very important thing is, if you do not study previous year topics, what will you study?
Correct.
Yeah? Because the knowledge is infinite, information is infinite, you need to know what is most important to study. So that's where the previous year topics come.
Interestingly, the line that sir said, and sir has been saying this line for so many months and years, the same line Web have said, the rank 1 NEET PG, that if you don't study PYT, then what do you study? I think you must have seen one of your interviews only. But that's so important, so important. GTs are always important. Gobind sir, many students are afraid of taking GTs. They say that if I appear for a GT and if I don't get a good score, I will feel disappointed. You have been teaching everybody that GTs solve 3 functions. Sir, what are those 3 functions?
So grand tests, they have much more role just apart from evaluation. Right. Obviously, they are evaluation tool. Right. From the GTs, you will come to know that which subjects are your strong subjects, which are weak subjects, where you need to work more harder, where you can give more time, where you can give less time. So that is one important thing, but that is only one thing.
Right.
But what is second very important thing about GTs, they actually give you the net practice for the actual exam. So during the GTs, if you study and then you go into the actual exam, it will be much easier. What I mean by easier is, like many students when they come out of the exam hall and then they say, yaar 8-10 silly mistakes ho gayi. So they are actually not silly mistake. No mistake is silly. Mistake is a mistake. So silly mistake can be reduced if you have practiced lot of GTs. Right. Now why I say silly mistake can be reduced is, so normally our brain is not tuned to sit for long hours and think for long hours.
Right.
When we start giving any particular exam, suppose you sit today, so in 1 hour, 1.5 hours, your brain will get tired.
Right,
so after that, even simple MCQ will start getting wrong because you are not able to recall things, because the brain is not tuned. Right. So but when you regularly give GTs, so that time will keep on increasing. So your aim is to make it for those 3 hours, because in the exam you have to think for 3 hours continuously. So GTs play in that training role.
So sir is saying that you are training your brain. Sir, a very interesting a story that a student told us, a topper.
Yeah.
Sir, can you share that?
Yeah. So one of the toppers we talked about, they said that I made the GTs simulate the actual exam, because I want that when I sit in the actual exam, it should look like I am giving another GT.
Right.
So what he told me that in the actual exam, because it is a CBT, so my center may not be having facilities, so may not be, water is not available, AC may not be working. So what I used to do, how I give GTs is, I switch off the fan and in the heat I give the exam, so that if in the actual exam I get such a condition, so I am tuned to that.
And that student also said that I would take a very bad chair.
Yeah,
because the chair
broken chair. Yes.
So what is the third rule, sir?
So third and the most important role of GT is, suppose you make any question wrong in GT and then you see why you have made that question wrong. So that will be imprinted in your brain. If similar type of question comes in the actual exam, you will never make it wrong. So I commonly keep on saying, GT में जितने question गलत हुए, उतने क्वेश्चन एक्चुअल एग्जाम में सही होंगे, बिकॉज वो गलत होंगे नहीं. यू नो यू आर मेकिंग मिस्टेक एट दिस पॉइंट. सो दो स्टूडेंट्स हु आर स्टॉपिंग गिविंग जीटी बट जस्ट बिकॉज ऑफ दिस फियर कि मेरे मार्क्स कम रह गए तो डीमोटिवेशन हो जाएगी. दे शुड एक्चुअली बी मोटिवेटेड एनफ कि मेरे अगर 180 क्वेश्चन गलत हुए हैं, सो देर आर मोर चांसेस दैट 180 क्वेश्चन आई विल नॉट मेक मिस्टेक्स इन द एक्चुअल एग्जाम, बिकॉज व्हाट मैटर्स इज द फाइनल एग्जाम. सो जितना एग्जाम जीटी में गलत करोगे उतना अच्छा है, बिकॉज इन एक्चुअल एग्जाम द नंबर ऑफ मिस्टेक्स विल बी मच लेस.
So if you have to make a mistake, make that mistake in the GTs, because in the real exam you would not repeat that mistake, is what sir is saying. And sir has been saying this for many years, and you know, if you talk to the toppers, they say the exact same thing, that I appeared for GTs again and again so that I don't make the same mistake. So please students, remember what sir is saying. Sir, this is good, but now all of these things need to be covered for our students, Cerebellum students. So what is our plan for that? Alright, so we talked about the conceptual and clinical learning, and for that Cerebellum has started something called as the mission live lectures. What are these live lectures? The entire course would be completed online in a live session by your teacher. So this is something which completes the course comprehensively, right? Because we want you to make better concepts, and these live lectures are somewhere in between the rapid revision or quick revision videos and the main videos. The reason, for main videos we need a lot of time. We don't have that much time left. Quick revision videos work very well if the exam is very factual and PYQ based, but they do not work so well when the exam is like NEET PG 24. So we have to get something in between which covers everything, gives you concept but can be completed. And that is how Cerebellum came up with this plan of mission live lectures. So that will be taking care of your conceptual and clinical learning. We said that the concise revision source is also very important, something that you can use in the end. Now students, we have two options. Of course, BTR, all of us know about BTR, it's a very high-end, very good resource. Some students say that, sir, I want something which is in sync with the live lecture because I want to revise from there only. For those students, do the live lectures, revise from the quick revision videos or quick revision notes. So both options are available. You can also mix and match. For some subjects, you can use BTR. For some subjects, you can use quick revision sources. So many things have been kept in the app so that whatever type of preparation you want, you have something to follow. Structure and discipline, Gobind sir, you talked a lot about structure and discipline. How will we ensure that our students remain disciplined, and what is the kind of structure that we are providing them?
So basically this was the most important thing why we started the live lectures. So since many years now the students had the access to the videos. Video lectures, recorded lectures were there, even rapid revision lectures were there in different platforms, but they were not serving the basic purpose, because the student, when they get the recorded lectures, they have the in the mind that mere paas pada hai, I can see at any time.
Right.
So but that any time never comes, because number one, the student keep on procrastinating. And number two, what happens is student will see some portion and then they will start doing some other work, and then that portion is left and then he will restart 3 days later.
Right.
So resulting in that most of the students were not able to complete the syllabus in the desired time.
Right.
Clear? So that's why we started the live lectures, so that your syllabus completion becomes our responsibility. So the teacher is sitting in front of you for 5 or 6 hours, he is teaching, so you have to sit. Just like in a live class, you cannot go away. Okay, मैं बीच में चलो घूम आता हूँ. So class is going on, you will miss that thing. So you have to attend that. So that will give you a structure and discipline. First of all, discipline is there, so you need to sit with the teacher so that you can complete the entire syllabus within a stipulated time. Second, obviously the structure. So we have made the program in such a manner that we have decided that this subject requires this many days, because we have the experience that how much time should be devoted to one particular subject. So accordingly, the teacher will complete the syllabus, and onus is on you that you also need to complete the desired syllabus in the desired time period. So that means you will get a particular structure that within these particular time you have to complete entire syllabus, so that you can revise in the later time also.
So the onus is on the teacher. All that you have to do is to show up. So we are kind of combining the good things about the online teaching with the good things about the offline teaching, and that is what gave birth to the mission program. MCQ practice. So we will show you the detailed schedule, but these are the things that we say that you should utilize for your MCQ practice. E&Ds are very important because these are tests and discussions, live tests and discussions. We will give you a test after a subject has been completed. Say I complete psychiatry, then I'll give you a 75 question or 100 question test. You take the test, and in the evening we have a live discussion. You can use QBank. The QBank has been updated completely. It's now much more clinical, much more relevant. Just have a look at the QBank and you would love it. So if you can make custom modules using the QBank, that is another source of your MCQ practice. And then Zainab ma'am combines multiple subjects together, and we have our BTR E&Ds. So we say we combine 3 or 4 subjects and then we take a test. So subject wise test mixed with combined test mixed with custom module gives you enough options of practicing MCQs.
So I will want to add here, the E&Ds, they are not only the question practice, but when the teacher discusses, you will come to know that where your questions are getting wrong. So many times we are doing MCQs by ourselves, and then we only come to know that yes, this is correct, this is wrong. But when the teacher discusses, you will come to know that what your thinking was while answering that, but the actual thinking should have been this way. So you will get the art of solving the question so that you make lesser mistakes during the actual exam.
Very well said, sir. PYQs, PYTs, I think this was one of the most hit segment of the app. All the toppers talked about it. So what are PYQs, PYTs? We'll be covering them in late night PYQ, PYT marathons. Basically at 11 o'clock in night, a notification would come in your app that now today's late night marathon session is on. It would include some questions, 60 questions, 50 questions, 75 questions. Many of them are previous year questions. Many of them have been taken from previous year topics. We are going to make them live at 11 p.m. Reason, we want that you study the entire day. Late at night when you're a bit tired, you do something which will take less efforts. And we want that you practice PYQs, PYTs from the day one. So this is going to get you into that habit of solving PYQs, PYTs and also the habit of solving MCQs. Grand tests, again our aim has always been to create grand tests which can be closest to the actual exam. And there's another thing that we do at Cerebellum. Some of the grand tests we give you a written answer, written explanation. For some of the grand tests we give you video explanation. So that the teacher, what Gobind sir was talking about, the art of solving MCQ, in those videos the teacher also talks about this is how you should have answered it. And you can just relate with that and compare that was your approach correct or not. So these things we will give you in the app. Let's talk about the detailed schedule. Now this is Mission 2.0 Target NEET PG 2025. So we are starting with the live lectures from 5th of September. I would be starting the batch. 5th September 5:30 p.m. I would be there on the app and we will start studying. 5th, 6th, 7th in 3 days, around 5 to 5.5 hours per day, we will complete the entire psychiatry. On the 8th September, 10 o'clock in the morning, you would be given a test. You will be given 5-6 hours to complete the test. After the test is over, you would be told your score, you would be told your rank, and around 5:30 in the evening, I would again come in the app and we would discuss that test in a comprehensive way. After me, Dr. Anand would be taking up pediatrics, then Dr. Praneeth would be taking up ENT. Now you can see that enough days, even the small subjects are being given 4-5 days. Why? We want to cover it comprehensively. Then physio, then Goga sir himself, then we'll have GTs in between, and then we'll have PSM, PSM1, PSM2, anatomy, surgery, anesthesia, OBG. Sorry guys, only 3 days Diwali break. The exam is very important. OBG2, pathology, and then we have our INICT exam on 10th of November. Even if you are preparing primarily for NEET PG, we want you to appear for this INICT exam seriously. Take it seriously. Then we have got medicine. So see, medicine has been given 8 days, 4 plus 4, 8 days. Radiology, GTs, dermat, ortho, biochem, ophtha, micro, FMT. We are going to take around 4 months, starting from September 5th till December 22nd. So September, October, November and almost 3 weeks of December. This is so that we can complete everything comprehensively. Even if you are starting from scratch, even if you are somebody who did not study well during the MBBS, even if you are somebody who got a bad rank, this is the program for you because it is starting from the scratch. How to use notes or the new workbook that we are coming up with. Now we have talked about this in the past also. If you are following mission plan, we have got quick revision notes that are mostly in sync with the live classes. You might have to add 10-15% content extra. Main notes are also there, they are very important, but we suggest that if you are appearing for the upcoming exams, quick revision notes would be better. Students who are interns or final year or third year, for them main notes are better. We are also coming up with workbook. Now there are many students who say that I want to learn actively. Teacher is teaching but I also want to write. So for them we have come up with workbooks. They are completely in sync with the live classes, but you have to write. So if you are somebody who wants most of the things written, quick revision notes are the one for you. If you are somebody who want to be more actively engaged, then you can go for workbook. Now workbooks are yet not out. We are about to start with the pre-booking, say somewhere around 2nd or 3rd of September, and the dispatch will happen. Okay, and I think the dispatch will happen only after 10th of September, right? So I mean, messaging us is not going to solve the problem. This is something that we just did after a lot of demand from the students, and we have to ensure the quality. So for the first, second, third lecture, we will give you the PDFs of the PPT that we are using, so you'll have something to write upon.
So basically I will revise what is there. There are two main sources which you can utilize with the lectures. One is quick revision notes, second is the workbook. Quick revision notes are around 80 to 90% in sync with the lectures. So you may need little bit to add in that or maybe little bit to delete from that. But mostly it is in sync with the lectures. So if you do not want to write, you mainly want to study. So you can follow quick revision notes. But suppose if you want to do active learning, so there are two methods you can adopt. One is to write complete notes, but that will not be usually possible because the time is not that much. So if you are one who want your own handwritten everything notes, write completely. but that is usually practically not possible for 99% of the students. So there we have come up with the solution of workbook. So workbooks are in the process of getting ready. So workbook, how you can utilize is, there will be around 70% written in the workbook already. Only 30% things, small things, one liner, one word you need to write. So that active learning also occurs, and you do not need to write too much things also. As Dr. Praveen said, the disclaimer is that workbooks are getting prepared. So first few subjects, maybe 2 or 3 subjects, you may need to do without those workbooks, even if you order them, because the dispatch will take time. Dr. Praveen has said 10th, but it will take even longer than that. Usually the limit we are taking is 20 September. Definitely we will try to send it by 20th of September. And first few subjects, 2-3 subjects, how will you do if you want to do from the workbook? So we will send you the PDF of the lecture which the teacher is taking. So you can annotate on that. Right. And after that the workbook will be available.
Right. How to use the late night PYQs, PYTs? This is very important. It will come in the app at 11 PM every night. Please appear for the test, do all those questions, do not miss them. In the end, PYQs, PYTs can make a lot of difference, right? So December 22nd is when our first lab finishes. So after that, say the exam is scheduled on 15th of Feb. We'll create a revision program for that. If the exam is scheduled later, we'll get more time for revisions. So revisions would happen. Dr. Zainab's BTR ENDs. Now the current cycle of BTR ENDs is tuned towards the INI examination. But once the INI is done, we'll have more BTR ENDs, more focus towards NEET PG exam. That would be announced. Marathon is something that we do 1 week before the actual exam. So before INI-CT, we have marathon INI-CT. Before NEET PG, we have marathon NEET PG. Similarly for FMG exam. The concept of marathon is in around 7 days, in around 80 hours, revise everything. Basically, one of the demands of the students and one of the requirements of the students was have a last minute revision. So we decided that let's again put the onus on the teachers. In 7 days, we have to complete everything. Imagine you are asking somebody like Goga sir to complete the entire pharmacology in 4 hours. Just imagine what kind of content he will teach you, that too live. So these are very high-end, very useful. All the toppers have loved these marathons. Similarly, Dr. Zainab also does something similar, which is called as Mega BTRs, 2 sessions or 3 sessions right before the exam. And these marathons and Mega BTRs are also always in sync. How to subscribe? Of course, you can go onto the website www.cerebellumacademy.com. Go to the plans. I think on the top only is a plan called as Mission 2.0. You can subscribe to that. I think 6 months plan is for around 20K. 1 year is around 25K. You can use the coupon code Cerebellum. That will give you some discount. And students, please remember that Mission 2.0 is our premium plan. What does it mean? Whatever is there in the app is included in the mission program. Not only that, whatever would come in the app would also be included in the program. When we started the app, we did not have live lectures. But those students who had taken premium plan, they were given the live lectures free of cost. BTR was brought later, premium students were given that free of cost. All these things, ENDs, late night PYQs, all of them were introduced later. Whatever we do, a premium student would always get it.